We're pleased to have with us New York City dermatologist Dr. Alan Kling.
Now, doctor, when a patient comes to you and he's really afraid about losing his hair, what are the first things you tell him?
First thing I do is evaluate a patient to make sure that there aren't other medical reasons that for why they're losing their hair, other than pattern baldness. I check to make sure there isn't a certain dermatologic, a skin condition. Dandruff, severe dandruff, seborrheic dermatitis, psoriasis, eczema of the scalp can contribute to it. Certain medical conditions, endocrine disorders, thyroid conditions, chronic illnesses can also cause an increase in the amount of hair loss. Many patients come in on medications which can cause hair loss, anything from anti-blood clotting medications to acne medications. Certain vitamin freaks are on megadoses of vitamins which cause an increase in hair loss. And then there are things like trauma, local trauma to the scalp, or if a person had a history of surgery several months ago, general surgery, you might see later on hair loss. So first thing is to evaluate to make sure there aren't any other reversible possible causes of hair loss.
Now, say it's male pattern baldness, okay? Minoxidil has been shown to, help reverse some of the hair loss that's going on. What exactly is minoxidil and how does it work?
Minoxidil is a medication which was introduced as an oral anti-high blood pressure medication in the 1970s. People took it by mouth, and lo and behold, 80–90% of them had a side effect of increased hair growth. But it wasn't just confined to the scalp, it was all over the face and the body. So it was placed into a solution form, and it was found to grow hair. It's believed to grow hair because it's a vasodilator. It dilates the vessels going to the scalp, and it also influences cell growth.
So it increases the blood supply to the scalp?
Locally. It locally causes certain changes so that there's an increased blood supply only locally, which causes increased hair growth. Baldness is a hormonally based condition. It is not related to a lack of circulation to the scalp.
So what are the results you've been getting from some of your patients?
Overall, roughly 2/3 of the patients have been getting some sort of a positive result. About 1/3 have an increase in hair growth. I'm talking about real hair. Half of that 1/3 is a dense increase in hair growth, another third more moderate. Another third of the patients say that no, they don't have an increase in hair growth, but what they notice is a decrease in the rate of hair loss. These are patients who had noticed that their hair was falling out at a pretty steady rate over time. Now they notice that there's less hair in the tub at the end of the shower, less hair in the brush at the end of the day. And the final third of the patients don't notice much one way or the other.
How long do you have to use it to get any results?
I tell my patients to stay on the medication at least 9 to 12 months to be able to fully evaluate it. They may see the decrease in the rate of hair loss as early as 2 to 3 months, but to really truly evaluate increase in hair growth, they should be on it approximately 1 year.
And to keep that hair growth, they have to continually use it throughout their entire life?
You have to continue to use it twice a day, because if you stop 2 to 3 months after you stop, any improvement which you had will go away. There's not any penalty to it. It won't be worse than it was to begin with. But you have to continue it twice a day. And if you even decrease it to once a day, you won't have as much improvement.
I'm sure, like everything else, there must be some kind of side effects. Now, what are the side effects?
Most of the side effects which have been reported to date are local side effects, a little irritation or itching on the scalp. Very, very little of the medication is actually absorbed into the bloodstream. So we haven't seen very many systemic, generalized side effects from the medication.
Okay, now, what about the side effects that you might not have had time to find out about? Like, for instance, people basically, to get any benefits from minoxidil, have to continually rub it into their scalp twice a day, every day for the rest of their lives. Are there any studies going on now about what this continued use can be doing to them?
Studies which were available as much as 32.5 years after use have not yet shown any side effects. And the studies are continuing.
And how
Patients are being monitored.
I'm sorry. And how do you apply it? Do you have to apply it to just certain areas of the scalp all over? Do you put it on the hairs that already exist, or what?
The medication is applied twice a day to the areas which are thin or balding. And it's rubbed very thoroughly into the scalp, because you want to go to the root of the hair root, not into the hair itself. And it's also very important to rub it into the border areas, because those are the next ones which are going to go. And minoxidil is a very good preventive medication for hair loss.
I understand that for that penetration that you were just mentioning, they're using Retin-A to increase the effectiveness of minoxidil. Just briefly, because we're just about out of time, how is Retin-A being used to do this?
Retin-A, which is an anti-acne medication, also has other properties, and it's believed to increase the absorption and therefore the efficiency of the minoxidil. It also may have influences on cell growth on its own.
Now, doctor, one last question. How can a person be able to get minoxidil?
Minoxidil is a prescription medication. A patient should go to a dermatologist, the person familiar with disorders of the hair, to be evaluated. And it has to be given by somebody who is familiar with how it's used. You should not go to a general practitioner for this, but a specialist.
Well, we'd like to thank you for joining us. I think a lot of people learned a great deal about the mystery that is minoxidil these days. Thank you very much, Dr. Kling.
Thank you.